Welcome to the Extraordinary Health Podcast with your host, Dr. Paul Beckham. My name is Allie, and today we're going to be talking about our brand new laser that we have here in the office.
Yeah, the K-Laser Speciale.
It makes it sound so fancy.
It does, yeah. They are from Italy, so, had to get that Italian kind of accent in there. So, how do you think, or what are you thinking about the laser here?
So far, I am a huge fan. So we've had a K-Laser in the office, Cube Laser, for...
I've had it 7-8 years now.
Yeah. So, and we've been a member of the...
Laser Therapy Institute, yep.
Correct. Since, April of...
just this last year here,
Yep.
we became a part of the Laser Therapy Institute.
So, the big news about this brand new special laser Speciale, is that basically it's much stronger than our laser that we had in the office before. You're still going to get the same results. It's still going to do the same stuff. It's just going to do it a lot faster.
Yeah.
Basically, it's 5 times stronger than the one that we had previously. Still have
it, yep.
Yep.
And I think the big thing that people just need to realize, this is a therapeutic laser. It works with pain and inflammation. So anything that a person has going on that has pain or inflammation, laser therapy is going to work excellent at it. It's not a cutting laser. Yes, you might feel a little bit of heat with it because it does have some power to it here. But the nice part about the new laser is it actually has kind of some sensors in it, so it even senses, it's like the color of your skin, so it knows how to turn itself up or down. The depth of your skin, even the thickness of the tissues, so that it can give the most effective laser treatment.
Yeah, this model of laser is extremely customizable as far as treatment goes.
And we can even, if we want to, manually get out there, there's 8 different customizable settings on it for each individual program, whether that be for a shoulder pain. You get a lot of patients with, more rotator cuff, maybe a little bit of some biceps tendonitis, that kind of thing. And we can dial it in. Hey, maybe we want a little bit more inflammation reduction, a little more pain reduction, whatever it happens to be. We can dial that right in for them. But also with the programming from the Laser Therapy Institute, we're the only ones in the area that have it. Nobody else is licensed with them and can't be for, I think it's a good 40, 50 miles from where we're at here. So, if you want to come in and get the protocols that the Laser Therapy Institute has, we're the place to come to because we're the ones that have all of those special programs to get you treated. So, the big thing with the laser, I think, so like you kind of talked about before, is it's a 100-watt laser. So our previous one, had a peak watt of 20 watts. So what this does, it actually cuts the treatment time down by 80%. So like with our neuropathy patients we have coming in the office, if we were to do the full neuropathy treatment with those patients, it would take literally an hour to get both their legs, from their spine all the way down to their legs, as well as from their neck all the way down to their hands. And that's just a long time.
Mm-hmm. Yes, it was 15 minutes per extremity prior. So,
and now it's 12 minutes total.
Yeah. Yes.
To do both arms, from the spine all the way down to the hands, as well as the legs, or from the lumbar spine all the way down to the bottom of your feet. So, again, there's no laser out there right now that even kind of comes close to what this one can do. So, for you, it just means you can kind of get in the office, get treated, and get out in about probably 15 minutes with the laser treatment. If it's like a neuropathy type patient, the other therapies tend to last about another 15 to maybe 30 minutes there. So you'll be in and out of the office within probably 15 minutes to 45 minutes for your treatments to get that corrected. So,
yeah, we understand that your time is just as valuable as ours. So this has been great innovation, and I'm really glad that we've added it to our office.
And even for our staff time here too, they can pretty much get you in and get you treated very, very quickly, and not have a lot of wasted time there. It's I can't even really describe it because it's hard to even compare it to anything else, really.
Yeah.
There's just nothing. I mean, if we compare it to the old laser, I mean, it's like, wow, you can get in, get it done, and you're done. I know I've run some stuff on myself just to kind of test it out, and I think what previously would have taken, roughly 6 minutes was just a little bit over a minute. I mean, it just, boom, you're done. So,
Yeah. And then about, so other than just time wise and, wattage wise, Dr. Beckham was saying, customizable treatments, right? So it's pretty neat how quickly too it can identify like your type of skin, the depth of the tissue, and all of that. And it's very responsive. It happens within, I want to say, like 2 or 3 seconds.
yeah.
And even for the person performing the laser therapy, it has this new feature where if it's not moving quickly enough across the area, it will actually start to vibrate a little bit. And so it's like more intuitive for both the patient and the practitioner, which is really, really neat. I can't even get over. I still don't even know probably half of the new features.
Well, I mean, compared to our old laser there as well, now they have, 5 different wavelengths. I know they are looking at, those are all FDA cleared. They're looking at trying to get the 6th one. They do have it on here, but it's not activated right now because they haven't got that FDA cleared yet. But that's like a blue light therapy. So even people that have like inflammation that's going on in their skin, it's more like a dermatology kind of a laser because it doesn't penetrate as far. The blue light doesn't, but it can help out a lot if people have some inflammation kind of going on in their skin. So.
You were talking about how, everything is really safe. It's basically the same kind of treatment, just higher wattage. So about that, it does get warm, and that is the difference, in case any of you are wondering, between a class 3 and a class 4 laser, basically. So if you've ever heard of cold laser, that's a class 3 laser, right? So this is a class 4 laser, so it does heat up, it does get a little bit warm, but it is safe to do so as long as you're communicating with the practitioner or whoever's doing the therapy on you.
Yeah, and this laser is not going to let you even get to a point where it's going to cause any issues here. It's going to shut itself off, so... That's
how smart it is.
The nice smart features that they've built into it there. So, and I think looking at some of the different therapies that we can earn and conditions that we can use it on. I mean, anywhere from if you start down at the feet. I mean, you get neuropathy is probably one of the biggest things that we're going to see down there. Plantar fasciitis, some Achilles tendonitis, some peroneal tendonitis. This can literally cut the pain down by usually at least 50% with that first treatment. If you come in having just a consultation to kind of find out, hey, does laser therapy or could laser therapy help me with the condition that I have going on here? And we can give you a pretty clear picture of what it's really going to take to get you treated with it there. And then if that's all you really want to do is come in and have some laser therapy done, we can get you just set up with one of the therapists in the office here, and you can come in, get your laser therapy done on whatever it is. Could be an elbow, shoulder, wrist, hands, fingers, your jaw. I mean, a lot of people with headaches, you get that kind of that upper cervical spine where the muscles get super tight. This is, lasers pretty much going right through you. I mean, they'll say up to a depth of about 9 inches, but with most people, hey, it's going to shine right through you. Just like you hold the flashlight up to your hand in the dark and you see how that light penetrates and goes all the way through your hand. You can kind of even see the bones in there. The laser's infrared. You're not going to see that, but it's going right through your hand just like a light would too. So obviously the deeper it goes, the less light is kind of penetrating that, but that's where the different frequencies of the light kind of get in there. So usually those lower frequencies, getting closer to that blue light, is not going to penetrate as much, whereas you get out there to, some of that 1064 kind of wavelength there, it's pretty much going to go right through you when you're getting treated. So I'm just trying to think of some of the different things we've had, patients coming in with. I mean, you get a lot of people just kind of chronic neck pain. We use it a lot with our patients that we're going to, do like spinal decompression with. A lot of times that's kind of being paired with are shockwave therapy, because a lot of times before they have decompression therapy, we'll use some shockwave therapy on the level that they're needing to have treated. The shockwave therapy is really good at kind of relaxing the muscles, again, getting pain and inflammation out as well, but it also helps stimulate stem cell production in your own body so that your body can heal itself. So by getting everything kind of relaxed, then doing your decompression therapy, I'm seeing patients, I would say they're getting 50% better response than just decompression therapy alone, if not more. And then combining that with some laser therapy right after they're done, and especially now with our new laser, I think it takes, how long did it take? I know you just had somebody recently here, it was like 45 seconds or something like that.
Yeah. Yes, and that was actually tied into like decompression therapy as well. So we had done decompression and then laser, and it was so he had a cervical disc issue as well as a lumbar disc issue, and so we ran the cervical disc and the lumbar disc protocols on the laser, each of which were respectively 45 seconds only. I want to say with our I hesitate to use the term old laser because it's not old by any means. And it's
laser,
still less powerful laser. Yeah, there you go. So with that one, I want to say that protocol was about 4.5 minutes, maybe even 4 minutes, 15 seconds, but dropped down to 45 seconds with this one. And, you can feel it. You can feel it. It's a powerful 45 seconds. You can definitely feel the warmth right away. And, you start moving around after you're done, and you can kind of almost feel a little bit looser too, because it is actively reducing that inflammation.
Yeah. I mean, it's just crazy how that kind of works. So I know as we use it here, we'll probably start to give people more feedback here as far as how people are kind of responding with it. I think one of the other things that I was just looking at, having a bunch of research just kind of come in over the weekend here, was patients that have like long COVID, and literally using our laser, or what's called photobiomodulation, with our PEMF therapy in the office here, and just hitting those areas that are painful, that you've had from probably coughing and all that kind of stuff. So where you might have like costochondritis going on, and we can run this laser over those areas so that can start to feel better, but also running it over those lung fields so that you can actually be stimulating blood flow going to those lung fields. And that's how even the PEMF therapy works too. That's more electromagnetic, or it's pulsed electromagnetic field therapy. And the laser, it's light therapy. So we're kind of using two different therapies to work together here to hopefully get a synergistic effect or a multiplying effect between the two. And I know when we've used it with our neuropathy patients, it works just excellently with them. And with them, we even have testing equipment to make sure that yes, we are seeing that improvement, we are seeing them getting better, included with just regular physical exam and some questionnaires that we use with them too. So shoulder issues, boy, it just clears things up quickly here as far as the laser therapy and all that. I know I had some issues more with my hand that I just ran it on, had a little bit of inflammation going on, a little bit of irritation, just from working on patients on a regular basis, and I didn't even really notice any pain here after I had just run on it once. So it pretty much kind of took care of everything in one shot. I'm probably treating it maybe a little bit quicker than most people, but some people might get that result. Most people are going to need a little bit of a series of treatments there, but again, if you set up a consultation in the office here, we can give you a pretty clear picture of what to kind of expect, and if that we're seeing, that you're responding faster, obviously you get out of here faster, but we're pretty accurate usually with what we kind of figure out for you there. So that way, we can get you back to doing what you love to do here, get you living at your full potential. So
yeah, and you don't even have to have like a crazy condition, gosh, even just like a big bruise, like deep contusion, those things can clear up pretty quick after just a couple sessions of laser there. Even, if you've got trouble relaxing, there's even relaxation protocols.
Definitely.
There's depression and anxiety protocols. I mean, you name it, there's almost a protocol for just about anything in there. So yeah, it doesn't have to be anything major structural. It can be something that's systemic, that we can help you out with, kind of running it along the spine and spinal cord. And so if you've got something going on and you think to yourself, gosh, I wonder if the laser could help with this.
Yeah.
It sounds futuristic, but maybe we'll give it a try. Give us a call, email us, contact us, just ask us your questions, and we'll give you the answers. We'll let you know if we can help you or not, for sure.
Yeah, and I think just one kind of crazy thing that people, don't, or probably haven't seen, or have seen some research on it myself. We just had a patient in the other day that had a burn, and just how literally most people, when they have the therapy run, it gives them a good, around 50% reduction in pain, probably between 40 and 60 in that range there. So that's a typical response for most people with most kinds of pain or inflammation type issues going on. So, well, I think we could go on and on and on with different types of conditions here, but just kind of want to give people at least a brief kind of podcast here that kind of going over the laser and just how that could possibly help them. And, yes, it's something that, hey, if you want to explore it, come in the office. We'll kind of go over with you here and let you know if we think that it would be something that would benefit you and give you the best results that you're looking for here. I guess I hope the information kind of helps out here, and if you have any further questions, just contact the office. Otherwise, we'll see you next week here, or you can listen to us talk next week.
You can listen to us talk anytime on your favorite podcast app, actually.
Yeah. We're on iTunes. We're on Google Podcasts. We're on Spotify. We're pretty much just about any kind of podcast app out there.
But thanks for listening, and
we'll see you next week.
Sounds good.